Now, this Sunday, on the 29th of September 2024, would mark World Heart Day, a global initiative aimed at raising awareness about cardiovascular health, especially at a time when non-communicable diseases is on the rise globally. I'm joined in the studio by Dr. Jacqueline Thompson, who is a family physician and the Greater Accra Regional Focal Person for non-communicable diseases. Doctor, good morning, and it's such a pleasure to have you in the studio.
Good morning.
How are you doing?
I'm fine.
You're very pretty. No, I had to say it. I was stealing glances at you when you came to the back room there. Right. So let's talk about World Heart Day. What is the significance of this day, and why should we be observing or paying attention to it here in Ghana?
Okay, so World Heart Day is a day that is set aside to create awareness about the fact that we need to have our hearts to be healthy. Because globally it's been found out that about half of all deaths in adults is due to cardiovascular diseases, which includes, which includes diseases that directly affect the heart, as well as strokes, diseases such as hypertension and its complications, diabetes, kidney diseases, etc. So we realized also that in our part of the world, the prevalence or the incidence of this disease is on the rise. So it's important that we make people aware of what is happening and then put in measures to curtail the issue.
Then can you give us an overview of the current state of cardiovascular health in Ghana? Are we seeing an increase? Is there a steady rise? What's happening in terms of cardiovascular health?
Yes, so for cardiovascular disease, we are seeing just like it's the same picture, there's a reflection in our country. A study that was done recently at the National Cardiothoracic Center at Kolebu Teaching Hospital found out that about 60% of deaths are due to these cardiovascular diseases. So I think earlier this year, there's been few publicity, media interviews that I've granted, other people have granted, and we are talking about these NCDs. So as we commemorate the World Heart Day, it's another opportunity to make people aware that this is what is happening and we need to do something about it really quickly.
Okay, so in the spirit of creating awareness, let's do some education. What are the risk factors or the primary risk factors for heart diseases that Ghanaians should be aware of? Okay,
so top of the list is hypertension. So hypertension is also known as high blood pressure, or known in Cree as moja moroso. Okay. So there are a lot of people, a lot of Ghanaians who have high blood pressure, some of who are aware, they are aware, and then some of them are controlling it very well. Others are aware, but they are not taking their medication and not practicing the lifestyle changes that they are supposed to do to control it. And then we also have diabetes, mellitus, high cholesterol, and then we also have obesity, which are mainly the risk factors for this disease. Also, we have genetic factors, and then also being male is one of the risk factors.
Being male?
Yes.
So just by being male,
yes,
you stand a chance of
developing cardiovascular disease. Other risk factors are high stress.
I want to stay there a little bit because I'm curious. What's the explanation for that? For male, being male as a risk factor, but female is not a risk factor?
So with some of these things, it's just that they are, you're male. So these are what we call the risk factors that you can't do much about. Okay. So over the years, it's been studied, and then it's been found out that males are more predisposed to cardiovascular disease. I'm sure it's got to do with their genetic makeup, and also with the fact that probably they are more, how should I say it, aggressive, okay, or they are more stressed out. They have a lot of responsibilities on their heads. And then also, maybe we could also say that their health-seeking behavior is not as good as females. Yeah. So those are a few of those things that may explain why.
And we understand that lifestyle and dieting can help in terms of prevention and managing these diseases. So how can we individuals balance traditional diets and lifestyle with modern recommendation for heart health?
Okay, so most of the recommendations are talking about Western foods, you look at it and they're talking about you eating things like fruits like strawberries, blueberries, and then they explain that these are the benefits and things like that. But recently, there are books that have been written and certain guidelines that help us to be able to know that if you eat kontomire, if you eat the local vegetables and fruits that we have, it will help, in managing this condition. So we know that there are certain class of foods that are carbohydrates, certain class of foods that are proteins, vegetables, minerals, and vitamins. So it's just about knowing the kinds of foods in which class, which you should stay away from or eat more of, then you will be able to modify it. So we usually would educate the patients on what we have in our setting.
Okay, you mentioned green leafy vegetables.
Yes.
When I was a child, I remember that when they say they were not medical experts, but they'll do this and then say you need blood, and then they'll blend abedru.
Yes.
You know, is that healthy? Does that actually help
Yes,
with
it
your
does.
cardiovascular health?
Yes, it does. It helps, especially with anemia. The English name for abedru is actually turkey berries.
Oh, thank you.
Yes. Yes, because it has so many local names, Gosusua,
you
and
know,
all sorts of things.
Turkey berries.
Turkey
now
berries.
I won't forget that.
Yes. So yes, so eating what we have, the green leafy vegetables, knowing that you should get some proteins from vegetables as well, staying away from too much meat and other things. So when you meet your health provider, they are able to go down into details to educate you on what to do.
Okay.
Yes.
So aside lifestyle and dieting, in terms of policy, right? What are the steps being taken at policy level to address the growing burden of cardiovascular diseases in Ghana?
Okay, so over the years, we've had to adopt or come up with guidelines which has got to do with physical inactivity guidelines. So this physical inactivity says that we need to be physically active. How much physical activity do we need as people to be able to help prevent or treat these cardiovascular diseases? We say that exercise 30 minutes 5 times a week.
Yeah.
That's about getting a minimum of 150 minutes of exercise. I've spoken about that in the previous times where I've been here. And also leaning to the fact that now any activity is better than inactivity. Okay, and then we also
have...
So
it could be just walking some 5,000 steps a day. It could be just skipping in your room somewhere.
Yes.
Just once you're moving your body, you're okay.
Yes,
okay.
So you're sitting less and then you're moving more. Okay, so we also have the hypertension guidelines, which shows us at which point in time we should start medication, at what point in time lifestyle should be used to treat, and then etc. We also have the cardiovascular disease guidelines, which was launched a couple of years ago, which directs us as healthcare providers what to do for each patient at what point in time. So nationally, doctors and other healthcare providers were trained in order to be able to use these. So these are the few things. And also we've also come up with wellness clinics, which are supposed to help to educate on prevention and also conduct screening for these diseases. So nationwide, we have adopted these.
How's the implementation of these initiatives going? Are there any challenges there that we should be looking at addressing?
Yes. So with regards to challenges, the challenges have got to do with the acceptance, because for example, a disease like hypertension, you can't see it. Okay, and so some people are walking around with very high blood pressure, as high as 180/110, 200, 150. etc., and they don't understand why they should do something about it. And also the health screening practice is not part of our culture. So trying to tell people to go to the hospital when they are not sick is quite difficult, because usually they want to have some symptoms that will probably break them down, especially for our male counterparts. So it's quite difficult in having to do that. Even telling them that go for things that are free, it's quite difficult. Recently, a study that was done for coastline hypertension in the fisher folk, many of them went for the screening, but then when they were referred to go to the hospital, the attendance was very poor.
Could it be a matter of finances?
Yes, yes, yes. That's what I was discussing with one of my colleagues yesterday, that it all boils down to poverty. So if that aspect of their life is not, dealt with, they need food to eat, and then you're telling me I should go and spend hours at the hospital. I'd rather go and work. Hypertension is your disease you are telling me I have. So yes, poverty, I think, is the baseline for all this. If we are able to tackle that aspect, which is not going to be easy, then we'll be able to educate them to help them to understand better.
But while we work to, eradicate poverty, is there something we can do to gradually shift the mindset of I need to be visibly sick before I go to the hospital? How do we change that mindset? Okay,
so I think that it's got to do with liaising with people in the community, so that you know that it's got to do with your peer, someone, because if it's an outsider, supposing I go to a community and go and talk to them about it, they're like, okay, you are sitting up there, you are a doctor, you are this and that, you think that it's sane for us. But then if there's someone who is their peer in their community, is able to identify better with them, then they will be able to probably accept it more. And then it's also got to us, to do with us, pushing more. I keep saying that if I talk to 100 people and even 2 people accept it, if they start practicing it, whatever it is that is working for them, and other people see it, then they'll be able to know that, okay, if I do A, B, C, I'll get results X, Y, Z, and then it will help. So it's a gradual process, but we need to keep at it. We shouldn't give up, because eventually we should be able to get there.
And this helps, public education, awareness creation, so we should take advantage of that. So for those at home watching us, what immediate steps, or what 3 key steps can you give them as a way of reducing their risk of heart diseases?
Okay. So first of all, I'd like to start from prevention. So prevention has got to do with adopting a healthy lifestyle. So a healthy lifestyle has got to eating healthy. Okay, so eating healthy, and then engaging in physical activity, walk, skip, jump, move, lift weights, whatever it is that is comfortable for you. And then keep moving. Don't sit for long hours, because sitting for long hours has been found to be as bad as smoking cigarettes.
You don't say?
Yes. So move more and then sit less.
I'm struggling to actually reconcile that.
Yes. So for people who sit more, studies have been done to show that the diseases that a smoker is predisposed to is an equivalent of what someone who sits for long hours is also predisposed to. So it says that sitting is the new smoking. So you don't have to light a cigarette and put it to your mouth. You just sit for long hours and then you are exposed. And then also, the third thing I'd say is that if you have diabetes, hypertension, high cholesterol, take your medication, do what you've been advised to do by your healthcare provider, take it seriously, and then you should be able to avert all the complications of cardiovascular disease.
I've learned something really interesting from you today. So basically your 3 points: eat healthy, exercise regularly, and if you stand a risk, listen to your healthcare advisors.
Exactly.
As we observe World Heart Day, what would be your final word or main message, or just a wrap of your thoughts regarding heart health, and then we can go.
Okay, so the heart is the engine of the body, and it's very important that we take good care of it. The heart is the organ that has been beating since you were in your mother's womb. So it's very important that we really take care of our hearts so that it can last us a lifetime.
And that there is Dr. Jacqueline Thompson, who is a family physician and the Greater Accra Regional Focal Person for Non-Communicable Diseases, shedding light on World Heart Day and how we can stay safe. Thank you so much for joining us.
Having me.
All right, we'll take a quick break and we'll return with more on the AM show. Don't go away.